Hello, my name is John, and I'm the student physical therapist that's going to be working with you today under the supervision of Dr. Purcell.
Okay.
How would you like to be addressed?
Logan.
Logan? Well,
Yep.
it's nice to meet you, Logan. So before we get started, I just want to tell you that I will be taking notes on my laptop over here just to get all the important information from you.
Okay.
Is there any religious or cultural beliefs that I need to know of before we get started that might impact my care of you?
No.
Okay. All right. So let's get right into this. What brings you to physical therapy today?
Let's see. I've just been having some right knee pain for about 3 years now.
Right knee pain. Okay. And how would you describe this right knee pain? Would you describe it as more in the front, the back? Would you describe it deep or
Front.
Front.
The
Okay.
front of the knee and kind of like right below the kneecap-ish and
Okay.
kind of like pretty superficial, I'd say.
Okay. It's pretty closer to the surface, you'd
Yeah.
say. Okay. Well, I'm sorry to hear that. That must be frustrating. So I see on your intake form that you had a femur fracture, right femur fracture.
Yeah, back when I was younger in like elementary school, so it's been a while since then.
How many years would you say?
I can't remember, maybe 10 to 15 years.
10 to 15 years? Wow. Okay. Then has this pain been around ever since then, or?
No, so this has only going around for about 3 years now. So
Okay, 3 years. Okay. So after that fracture, did the pain go away? Then it came back about 3 years ago?
well, I guess because the fracture was kind of in my thigh area, and I didn't have physical therapy or anything like that. I just was braced up and in a wheelchair and crutches for a while, so I was off it for I don't know, 8 months, close to a
Okay.
year.
And you didn't have physical therapy after that?
No, I kind of just had I just did workouts that I thought would help it.
Okay. You did your own thing trying to get it healed up?
Yeah, with some help of, there was a chiropractor in our town, and he just gave me some simple ideas
Okay.
for workouts to do, but no, nothing scheduled or coordinated.
So after that, the pain went away, and then it came back about 3 years.
Yeah, I never had pain. Once I got off my crutches and was able to go on, I never had pain, and then
Okay.
just been having this pain in my knee for the last 3 years.
Okay. All right. And so right now, sitting there on a scale from 0 to 10, what would you, 0 being no pain and 10 being unbearable pain, what would you?
Just 2 or 3.
2 or 3? Okay. 2 or 3. And at its worst, what will it get up to, and what kind of activities are you doing that cause it to get up that high?
So I guess it's gone up to a 7, and that was after a long hike. I was hunting, so it was after a long hike.
Okay.
And that brought it up to a 7, and that's the worst it's ever been.
Okay. Are there anything other activities or positions that get you up that high?
No, not that high. I mean, stairs kind of bother it sometimes.
Stairs. Okay.
Yeah, and I walk my dogs, and sometimes they like to pull.
Okay.
And so if I go on too long of a walk with them, I feel like it's a pulling and me kind of jamming my leg in the ground, kind of
Yeah,
to stop
and
them.
then, like,
Hurts it.
Incline, unlevel surfaces, stairs, and hiking, that sort of thing.
Yeah, and
Yeah.
just the longer I'm doing it, that's when I really feel the pain.
Okay, understood. That must be frustrating. So at its best, what's the lowest pain level it can get to?
1. It's kind of always
1.
like
Okay.
just a discomfort
Okay.
if it gets under, but
And is that when you're just relaxing and
Yeah.
just laying around?
yeah,
Okay.
exactly.
All right. So you said hiking. What are some activities that this prevents you from doing, or maybe gives you difficulty doing?
I guess besides the 3 that I said, like the hiking, walking my dogs, and like
Yeah.
the stairs.
Okay.
I do some weight training, and I guess if I'm squatting one
Okay.
day, like I try not to do too much with squats and like that, because I know it might flare it up.
Yeah.
So I
Okay.
kind of can flare up for maybe a day or 2.
Okay. So since this pain started 3 years ago, you haven't gotten any other treatments or anything like that?
No.
Have you sought out imaging or any tests that might tell you what's going on?
No, I mean,
No.
I guess it feels pretty stable. I'm not worried about it.
Okay.
Like my balance on it is fine.
That's good.
It's just kind of like just some pain in the front.
Okay, understood. All right. So it says here on your intake form that the type of pain is dual and aching. Is that, and it changes, gets better and worse. So you never get anything like burning or tingling or anything like that?
No,
Okay.
nothing like that.
Okay, no shooting pain or stabbing pain, anything
No.
like that.
No.
Okay. Now does that right leg feel weaker than the other leg?
Yeah, ever since I injured it,
Okay.
it's always kind of been weaker, and you can tell the size difference.
Okay. All right. So there's not much that I need to address on your intake form other than it says that you have family history of heart disease. Can you talk a little bit about that?
Yeah, I just know that my mom's dad, so my grandpa, he had some heart problems, and he passed away from it before I was born. But I know that it was heart related.
Okay. I'm sorry to hear that. All right. Let's see. So now that I've gotten all this good information from you, one more thing. So it says here you don't take any medication for this leg.
No.
So does that include like over-the-counter medications such as ibuprofen and Tylenol and Advil?
I guess basically I rarely take them. Maybe if the pain's really bugging me, or after I go take a hike and I know that the pain's gonna be there, maybe I'll pop one or two, and just kind of before that pain really hits me.
Can you tell that helps you?
Yeah, maybe a little bit.
Okay, that's good. Okay, so now I just want to know a little bit about your living situation. So what type of home do you live in? Who do you live with? What is your support system like here? What's your occupation?
Okay. So I guess I live in an apartment with my girlfriend. I don't have a job. I'm still going to school. I'm in grad school now.
Okay.
And so yeah, and good support system. It's just me and my girlfriend here. All of our other family are out of state, so it's just kind of us here.
Okay. And your girlfriend's pretty supportive and wants to see that leg get better?
Yeah,
okay,
definitely.
That's good. So you said you're in grad school, so where are you here from?
I came from New Mexico.
New Mexico? Oh,
Yeah.
That's awesome. How do you like it here?
It's pretty good. It's kind of hot like New Mexico. So
How long have you been here?
probably a little over half a year.
We'll have over half a year. That's awesome. It's good to have you here. What are you in grad school for?
PA program.
PA program.
Yeah.
Nice. It's a great profession.
Yeah, looking forward to it.
Okay. Then, so you're young, so I assume you've never been on it with any other than the crutches. Whenever the incident happened
Yeah.
when you were young, you never had to use any assisted devices.
No.
Okay, that's good. And would you say your activity levels decreased a good amount since this pain has come around?
I guess maybe a little bit. Maybe it stopped me from going on a jog or some longer hikes.
Okay.
I still do some resistance training, like weight training, but that really hasn't slowed down at all. But maybe I've kind of stopped jogging and hiking as long.
Okay. And in these 3 years, has the pain gotten worse?
It just feels like that the pain stays for longer, and that it starts sooner now. I don't have to go for as long before I know the pain's gonna be there.
Okay, understood. All right, so now what I want to do, I just want to ask you some questions, just to kind of get an overall reading of some of your organ systems, such as your musculoskeletal, your cardiopulmonary, that type of thing. So I'm going to ask you some questions, and I just want you to answer if you have been experiencing any of these things, okay?
Okay.
So have you experienced joint pain, swelling or stiffness, muscle weakness, or pain that never changes?
Besides in my knee, no.
Okay. So coordination, balance problems, vision or hearing changes, involuntary tremors or severe headaches?
No, those are
none of that. Heart palpitations, chest pain, shortness of breath, coughing, hoarseness,
Nope.
Cold or blue fingers.
Nope.
All right. Rashes or skin changes.
Nope.
New or changing moles.
Nope.
Soreness that won't heal, or changes in your nail beds.
Nope.
All right, that's good. All right, so now I just want to ask you what your goals are from physical therapy, and I assume that it's just to decrease this pain during these activities and be able to kind of return to your prior level of activity before this pain started 3 years ago.
Yeah, basically, yeah, just
Okay.
to kind of stop the pain and stop it from staying for as long. And I guess I know it's not going to go away, but it'd be nice to be able to go on longer hikes.
Why
and
do you
walk the
say
dogs.
you don't think it'll go away?
It's always kind of been there the last few years, and I
Yeah.
know the older I get, it might just kind of linger
Well,
around.
this is the first time you're visiting me, so
True.
hopefully we can get that
Hopefully.
pain gone for you. We
That'd be
gotta,
nice.
we gotta stay positive here, all right?
Yeah.
Especially since you don't have any imaging or anything like that that tells us what's going on in there. So that might be something that we might want to look into also, is get some imaging to see what's going on in there.
Okay.
All right, so what I want to do now, I'm just going to summarize everything that I've learned from you relating to this this issue you're dealing with.
Okay.
So you fractured your femur, and by the way, how did you fracture your femur?
It was in elementary football.
Elementary football. Oh my
Yeah.
gosh.
Yeah, it was. Yeah, definitely.
Did you get tackled?
Yeah, I got tackled from a bigger guy, tackled from behind.
Oh
so,
my gosh, that is crazy.
Yeah.
All right, so then you had that repaired around then, right after it happened.
Yep.
Then so the pain subsided after that kind of healed up. Then 3 years ago, and that occurred kind of 10 to 15 years ago, a long time ago.
Yeah,
It
sixth
should
grade.
definitely be healed up by then.
Yeah.
So 3 years ago, you started experiencing this new pain in that area, and you said it's gradually kind of gotten worse with activities that you like to do. You said it kind of prevents you from going on hikes, longer hikes.
Exactly.
It hurts from going up and down stairs. It kind of affects you walking your dogs and whatnot.
Yeah.
Okay. So right now you're at about a 2 or 3 on the pain scale. The best it'll get to is about a 1.
Yeah.
The worst it can get to is about a 7, and that's from activities maybe on unlevel surfaces or walking your dog, like
Yeah.
hiking or walking your upstairs, or is it downstairs also, or can you not tell?
I'd say, I guess probably both actually.
Both.
Yeah.
Okay. All right. All right. Let's see. All right. Then you're not on any medications for it, other than sometimes you take ibuprofen or over the counter. The only really medical history we have that might be relevant is your grandpa on your mom's side
Yeah.
died of heart issues, which is sad to hear. Is there anything else that I'm missing that you would want to clarify, Ed?
No, not that I can think of.
You live on the 5th floor with your girlfriend. You just moved here
That's right.
for grad school from New Mexico.
Yeah.
And yeah, so all that's good. Good information for me with treating you. So what we're gonna do next is we're going to go into the exam portion of our visit,
Okay.
and I'm just gonna be taking some measurements, testing some muscle strength, that sort of thing,
Okay.
just to see where we are, more specific to that leg area. How does that sound?
Awesome.
All right, we're gonna do it, and thank you very much for visiting me today, and we're gonna get you feeling better.
Perfect.
All
Thank you.
right, thank you.